Good afternoon, everyone. Great to be with you today in our frontline conversation with Tonia Wellons. We've been doing this for a little bit now in terms of interviewing people who are dealing with the impact of COVID on a daily basis in the greater Washington region. Tonia, good afternoon to you. Very, very pleased to have you with us today.
Good afternoon, Doug. It's my pleasure.
Thanks. Let's start off with how are you doing personally? How's it going?
Personally, I am doing just fine. Nothing much to complain about. You know, I think we can all say that we're probably a little tired of so many Zoom and team calls. But you know, that pales in comparison. My family is well, healthy, and safe. My team is good. They're busy and on all cylinders. So there's not much that I can complain about. I would like to say I have a high school senior who's graduating in the global pandemic, and along with numbers of other class of 2020 kids. So I want to give a quick shout out to the class of 2020.
From what school are they graduating from?
She's graduated from Largo High School, Prince George's County Public Schools, and our school superintendent, who I think, I know she's an LGW alum as well, has organized for a national broadcast of PGCPS graduation. So we're pretty excited by that important stopgap measure.
It is exciting. Good for Monica Goldson. We'll be talking with her in a couple of weeks here. So we're excited about that too. So are you working from home?
I am. We have been working from home since I closed the office on March 13th. It's interesting, Doug, because our annual gala was scheduled for March 12th. And just 3 days prior, we had to make the tough decision to cancel our gala. That was when the first cases were discovered in the district. Cancel our gala for March 12th, close the office on March 13th, and pivot immediately to COVID-19 response, which is what we've been doing for the last 9.5 weeks.
And you were just recently, you've been with the Community Foundation for some time, but you were just recently promoted to the head of it for the Greater Washington region. So
that's right.
Tell us how that's worked with working from home.
Oh, it's been interesting. I've been saying that I've had to use every leadership skill I've ever read about, learned, aspired to have to be able to help make this shift. So my appointment began on March 31st. When the announcement was made, I was offered the job, and of course, my entire team is remote. It's been fun though. You know, it's been fine, not fun. It's been fine because I have an awesome team, and I've been at the Community Foundation for a little less than 4 years. So well aware of the players, but we've all had to shift and adjust. You know, take all of our operations like everyone else. You know, to a remote environment, which has also meant some interesting shifts for our nonprofits. You know, gone are the days for now of mailing a check. So to actually receive a grant, we've had to help our nonprofits shift to ACH and to other forms of payment receipt. But it's going well, and I'm glad to have been chosen to serve in this role for this time right now.
So you started working from home on March 13th, and you were appointed the position on March 31st. You were sort of acting in the meantime.
That's right.
And as you said, you had to pivot immediately after March 15th to COVID. Tell us about some of the things you did to turn the Community Foundation around or redirect them, and you mentioned some of the people you work with and what you did with them.
Yeah, it's interesting because we had to cancel our gala, and it's interesting. Our first coordinating call, one of the roles that we're playing in the region right now is helping to coordinate broader philanthropy, you know, alongside RAG, alongside the United Way, and other amazing partners. But we have a call every Friday, and we have had one for the last 10 weeks with, you know, about 70 members of philanthropy, institutional, individual, and corporate, to talk about the needs of our region and how we're going to work together to respond to them. So we've shifted from, you know, gala to opening a COVID response fund to working alongside all of our peers across the region to make sure that our efforts were coordinated. I was sharing with Chase earlier that we've also had to onboard 2 new staff members remotely. So we had plans to have two new team members begin on March 16th. And I tell you, making pretty quick decisions, I wonder whether or not it was the right thing to do. And because they've turned out to be, we knew that they were invaluable resources when we made the offer, but the decision to bring them on in the midst of the pandemic was the right one. We're all shifting and pivoting and learning. And I think we should give ourselves some credit for that because we're doing it, even though we're trying to make decisions on a day-by-day basis. We're doing it and we're making some good decisions and pivots.
What are some of the challenges you've had in bringing the Community Foundation culture to your new hires remotely? I think that's something I'm very concerned about, of hiring new people, and how do you do that through Zoom?
Yeah, it's not. It feels sometimes a little abnormal, but it's where we are. I think we just have to create the opportunity where we're being vulnerable about the things that are challenging us. I mean, I've had both board members and staff members to have to experience death and some other hard times with their various families. Many are juggling working all day and managing kids and their other family responsibilities. And so, just making sure that we're exercising some grace in our way of engaging with each other. But there's also a huge amount of pressure, Doug, to be honest with you. When you are, living in the comfort of a safe place, we've not had to lay off any team members, and our job is to raise money and get it out quickly. There's an immense amount of pressure and responsibility to do that, both with integrity, of course, but with some urgency. And so there's a lot of pressure on our team to raise to set up new funds, to help our donors, the broader donor community, to make sure that we're doing this in a way that is non-duplicative and impactful, that reaches our nonprofits who are doing the hard work or the amazing work right now. We feel like it's a bit of a luxury for us to not move with some pace and urgency. So we are.
So you mentioned the COVID-19 relief fund that you put together. Tell us what was the thought process that went into that? What is it? Who's it benefiting? How can people make use of it?
Sure. So March 13th is when we pivoted to open the fund. We used some of the ticket sales from our gala to seed the fund. And of course, many of our, tried and true partners in philanthropy were the first to step up. Capritz Foundation, Meyer Foundation, through a coordinated effort with community foundations in Northern Virginia, we received a gift from Amazon. There are probably 42 institutions that have contributed directly to the COVID-19 response fund. And I just got the number, about 550 individuals that have made contributions. We've raised, for that fund alone, we've raised upwards of nearly $7 million. Wow. And just completed our first round of grant making from that fund. 700 in applicants, and again, $7 million is impressive. Clearly not enough to fill all the need in our community. But I'm happy to say that, again, we're coordinating with local government to make sure that philanthropic capital can fill gaps and can be used for catalytic purposes. 740 applications were submitted for the COVID response fund for grant applications. And I'm happy to share, of course, we could not fund all of them, but we were able to support 95 organizations across the region through our first round of grant funding. And working really closely with the staff of many of our partners in philanthropy who are helping us with the grant review, the application review, and the decision making. We've put together a regional steering committee that's making the decisions together. And so we've really pivoted. And if you can imagine, Doug, each of our individual philanthropies has its own approach to grant making, to decisions about which issue areas are should be front and center. But we've coalesced over the last several weeks to make some important and strategic grants together.
So you mentioned a regional steering committee. How did that form? Who's on it, or types of people?
So funders who contributed upwards of a certain level were able to opt into the steering committee to be a part of the final decision-making body. But we've really opened up the review process to almost all of our philanthropic partners, to sector leaders, so leaders in the workforce space that include local government leaders. They're in the workforce space, in education, in medical care and access. A few of our nonprofit intermediaries are working with us to make some important decisions about who should receive resources. Again, many of them are doing fantastic work already, but we really wanted to prioritize organizations that were supporting low-wage workers, expanding access to healthcare or to PPE to frontline workers, groups that were really focusing on the digital divide. We're really concerned, of course, about people who are experiencing homelessness or who are at the fore of housing insecurity. So we had to prioritize populations, which allowed us to make some important decisions about who received this first wave of funding.
So you're getting some shout outs in the chat column. Anna Bard very much enjoys working with you during these times, and she's thrilled to see your leadership. Anna Bard from Wells Fargo. So you talked about collaboration with some of them. What were some of the greatest needs you saw from your 700 applicants for the first one?
Yeah, they varied. I think we chose, but every sector, as we all know, is being impacted. We made a decision as a group to not prioritize food in our COVID response fund because we wanted our funders to fund the food distribution centers directly. And so many of our peers, Wells Fargo, PNC, World Bank Group, Clark Foundation, they made gifts to the Community Foundation for our broader COVID response efforts across sectors, but they also made grants directly to many of the organizations across the region that are doing food distribution. We didn't want to get in the way, let our processes get in the way of people getting access to food. And so I'm glad that we made that decision for round one. And again, it's been great working with the likes of Anna, again, our partners at the United Way, Meyer, Wells, Bragg, to help to think through the strategy of where we need to prioritize our resources. There are a couple of other things that I'm really proud that we've done and that we're looking to do. We know that just like in the business community that Black and brown businesses will be disproportionately impacted or have been disproportionately impacted by COVID-19. We're also expecting that nonprofits that are led by Black and brown people will also suffer. And so we've prioritized that at least 50% of our funding we're prioritizing those leaders who represent Black and brown communities to make sure that they are considered when it comes to our grant making. We're looking at organizations that are working at both the grassroots level, but also those that are operating at scale. And so we're quite proud of what we've been able to do so far.
So when you picked the groups to fund in the first round, you said food, you referred people to the Capillary Food Bank and other places. Yep. Which is very, very helpful. So thank you for that. Did you set, here's our top 5 priorities, just the top 3 priorities, or? We did.
There were 4. So it was around, of course, low-wage workers. And we really wanted to prioritize. And I think, Doug, that this issue area is going to be one of the spaces that's going to be worthy of note later on. I mean, especially from a research perspective. It is not common that philanthropy makes grants where people are issued direct cash assistance. A lot of our grant making in for low wage workers, people who were shut out or by the gig economy, or restaurant workers, hospitality workers, we prioritize making grants to organizations that were working on cash assistance related programs. So much so that now we're in conversations with local governments across the entire region about how to do some of that at scale, particularly for what we're calling excluded workers, workers who were not eligible for federal stimulus resources, and workers who are not eligible for unemployment. Many of them fall in the undocumented category. But we want to make sure that every person in our community has access to resources that they need to be able to support themselves and their families. So low-wage workers.
So I'm sorry, Tonia. So those are, your funding goes to direct cash grants to those people.
Yeah, it goes, of course, by way of a nonprofit.
Yes, yeah, through the nonprofit.
Absolutely. Again, this is a new space for philanthropy. I mean, in some spaces, this is done quite a bit globally, but it has not been a practice that we've seen very much in the United States and in the District of Columbia, in our greater Washington region. And so I'm just excited that we're able to do this because we know that this is needed.
So did you get any pushback from your funders on this, or people all said, no, this is something new we've got to do now?
Some are more comfortable with it than others. To be very frank, we've had to negotiate lots of differences. I mean, I think that is the beauty and the challenge in partnership and collaboration, that, we're not going to see everything eye to eye, but we're all keeping our eye on the prize, and that is making sure that that every element of our community, every population in our community is served. And so, again, it wasn't a resounding yes, 100% yes across the board, but enough confidence to say, yep, this is something that we ought to be doing, and let's learn from it so that we can continue to adjust our practice.
And your focus has been to work with the local governments and any government so as not to supplement what they're doing, but to provide funding to people who aren't eligible for the government grants. Is that right? Yeah,
in this case specifically, but I think generally speaking, we work very closely with Chuck Bean and the Metropolitan Washington Council on Government. We're very proud to say we have great relationships with local elected and appointed leadership across the entire region. And so we are listening to each other, we're watching each other's moves, so that with DC government, I have a great partnership, and I know that Eris Scales is on the call. I saw her name pop up. We have a great partnership with our local government partners. I mean, it's philanthropy and local government, of course, and the business community working side by side and in lockstep to some extent, again, so that we can fill gaps and offer catalytic resources to make sure that everyone is being cared for.
So you mentioned low wage earners as one of your priorities. What were the other three?
The other three, the healthcare access. We wanted to prioritize nonprofits who were in direct service roles so that they could have access to PPE and to things that they would need to be able to continue to serve the community. We did some funding to federally qualified health providers. We focused in on housing and homelessness and youth and education. And so those were the 4 issue areas.
So your health funding in terms of PPE, did you procure PPE, or you just gave them funding so they could then go through their normal channels and get that?
That's what we did. Yeah, we are not we're not a direct service provider. We're an intermediary, but we're making important grants to organizations that can deliver these services.
And youth and education, what are some examples of some of the grants you gave in that area, and what are people doing? So
we wanted to provide some supports to organizations. Again, everyone is pivoting, right? So many of our nonprofits who would be providing after-school programming to kids had to pivot themselves and really begin to think about the kids and their families. So the kids and their programs and the families, and understanding what they needed and being able to provide resources to them. A couple of our providers were making sure that kids who were transitioning from the regular school day in person had access to laptops, to tablets, and just had the additional support to continue to push ahead with their education. And we also supported youth who were disconnected already from work and from school, to make sure that there were sort of adults in their lives who could continue to support them even electronically while they're transitioning. Recognizing again that we can't touch everybody, but we really wanted to make sure that transitions were supported where possible, and that youth who were again most vulnerable, and we prioritize population. Our resources are not for everyone. In terms of socioeconomics, we wanted to make sure that people who were marginalized and had challenges already were giving some additional support. So we prioritize again, low-income families, the people with limited access to health care, people who are experiencing homelessness or housing challenges, and people who were perhaps disconnected or needed some additional supports to transition from the daytime, from a regular school day into a mobile, a digital environment.
And what are some of the housing support that you provided? So that was one of your 4 priorities.
Yes, we provided. One of the big challenges with people who are experiencing homelessness is the need to, if you're exhibiting symptoms, to be able to quarantine. And so some of our resources to nonprofit housing providers would enable them to cover any costs associated with either hotel rooms or with food provision for people who had to quarantine, so that they would not impact the entire shelter if they're living in a public shelter, but they would be able to have access to both the medical care that they need and the food needs that they might have, but outside of the broader shelter environment. We also provided some grants to, there's going to be, and there already has been, an increase in both domestic violence and in mental health. And so some of our nonprofits are having to bring on staff to implement telemedicine and telehealth care programs in a way that many had not done before. And we wanted to make sure that they had some of the resources at their disposal to be able to pivot.
So when you look to your next round of funding, are you looking to change priorities? Have you said we're going to keep these 4 and we're just going to work on those for the foreseeable future?
So we're deepening, particularly as jurisdictions are beginning to think about reopening. Our strategy is what does re-engagement look like, for our sector as well. If kids are going to be home with their families for throughout the summer because summer camps are being canceled, we want to begin to look at, what are some of the nonprofits, how are they shifting their strategy to be able to provide, some level of support to kids. So we will adjust we're adjusting our funding strategy to be able to respond to that. We are also adding in advocacy as a core emphasis of our funding strategy. One of the things that we are just a tad bit nervous about is, both donor fatigue and crisis fatigue. And I think it's important to note that many of these issues that we're in response mode to are going to be with us even as our cities and communities begin to reopen. Everything is not going to happen at once. So even as work is reopening, there's still going to be childcare considerations for us to be mindful of. And as we are looking toward the fall, and school is going to perhaps look a bit different from what we're accustomed to, making sure that that teachers, that providers have things that they need that will enable them to shift and to pivot. And so one of the things that I want to make sure that I communicate, Doug, is that we stay with it. That funders stay with the nonprofits that they are supporting. That we not think that a community is going to be immediately ready to snap back. As soon as businesses reopen. There's going to be a long tail to this, and we just need to brace ourselves for that and be prepared to stay with our community and support nonprofit and people for the period ahead.
I agree with you on that. I just think that people are talking about, when do we get back to normal?
Yeah,
We're going to get back to a normal. It won't be the normal we had before. It'll be
no,
something, but we all need to look at that. And we've seen Montgomery County, I think, canceled their summer camps. Montgomery
yeah,
College just said we are going to do remote for the fall semester. University of California system announced everything in the fall is virtual. And I
that's
think
right.
more and more of that. And if schools can't reopen in some
That's right.
way, as you said, the need for the daycare and other things to allow the parents to go back to work is going to be significant. So,
Yeah. And I think, there's some things that we don't want to go back to normal. There's a bit of surprise often that Black and Brown communities are disproportionately impacted. And I think what COVID-19 has done is just really shine a light on what many of us are calling, and I heard this in a presentation about a month ago, pre-existing inequities. So we've gotten comfortable with this notion of pre-existing conditions because I think that lays responsibility on individuals. But there were pre-existing inequities that this pandemic has just put a bright spotlight on. And so there's some things we don't. I mean, we want to continue to push the envelope, which is why advocacy is going to be an important part of our strategy for the re-engagement and the rebuild, or we're calling it rebuild or reconstruction, rather than recovery, because we don't want to go back to the way things were. We really want to go back to a place that's better, that recognizes, who our essential employees are, and that we pay them a fair and living wage, that we're able to put some of the protections around them. I'm the daughter of two blue collar workers, and my parents worked in factories in Southern Virginia for 30 years. But we lived a very, very solid middle class lifestyle. They had great wages, health insurance, paid vacation, paid sick leave, and a retirement plan. I mean, these are things that are not, that we know that these are the kinds of protections that workers and people need around them in order to be propelled to the middle class and to not fall by every shake in our economic system or every shift in our in our economy or in our healthcare system. So I'm hoping that the lesson in all of this is that we have to build stronger protections for people, not just for employers, but for people first, so that we can weather these kinds of storms and not have them to take us under or to do so much damage.
so in terms of trying to make decisions for the future and looking at what works and what doesn't work, how are you, so particularly the cash grants, we have a question from the audience, how are you tracking those grants to see the impact they've had, see how it adds to community resilience without putting too much of a burden on the recipient, particularly
Right.
if they're from an immigrant community or whatever?
Sure. So the first round of grants that we've made through cash assistance have gone to providers who are working with specific clients. And so our providers know the families that they are making. They understand what their situations are. They understand, what there are some strategies to assess, of course, need, like there is for everything. That has been working with the nonprofits that we made some of the first round of grants to. The conversations that we're in now are really about deepening that. I mean, it's a recognition that not all people are connected to nonprofits, right? So there are people who are experiencing a hardship that have never had to rely on a nonprofit ever. And so we're working with deep networks within community. And I think it's important that we not underestimate, that, community organizations are one level of work, but then there are other networks that we're trying to reach down into. So there's a criteria for whether or not you're eligible, and I won't bore you with all of those details. But we're looking at whether or not you qualify for other resources, and then what the the extenuating situations are to make some decisions. On the tracking side, for this new program that we're looking to launch as part of our phase 2 strategies, There is an ability to determine, and the studies across the entire world show when you make either conditional or non-conditional cash transfers, people do with the money what they say they're going to do with it. Like they use it to buy food and to pay for medicine or to pay for school fees, just like we would. I think there's going to be a shift in trusting, especially low-income people, to be able to understand what their needs are, just like you and I. Like they know they need to pay the fees for for graduation, for example, and they're using their resources to make those decisions for themselves.
So,
two other points, if it's okay, because
absolutely.
I've noted the broader COVID response fund that the Community Foundation is managing in partnership with a number of, I saw Julia Bear Cooper on in the chat. England Family Fund is one of our funders and supporters. But we've also captured at a very high level, all of our Community Foundation funds. We've deployed already $15 million in funds out to nonprofits, and that includes, we've had a developer in our community who set up a fund with us for low-income housing tenants to be able to access cash to be able to respond to their needs. Let me take a look at my notes. The Fabio Trabacci group set up a fund with us for their restaurant workers, as did the Clyde restaurant company. A number of companies in our region have disaster funds with the Community Foundation that have been activated to be able to support staff members. And so I just want to make sure that I fully acknowledge the generosity of this community. That's just with the Community Foundation's overall funding. But there's also, we've collected data on some of the parallel grant making that's gone out to food banks, et cetera. It's as much as $12 million across a number of our partners. And so I want to make sure to recognize that the need is tremendous and the community is responding. And that's just what we know of. A number of people who received stimulus checks decided to donate those to grassroots-led. So I'm really proud that the community is responding in this way.
And the Capillary Food Bank said they're getting a lot of those $1,200 checks as well.
Absolutely.
Who are donating quite a bit. They've seen their donation levels rise. Their need has risen dramatically, but their donation levels risen.
Absolutely.
And there's real devastation out there. I mean, we talked with Kathy Hollinger from the Restaurant Association. 85 to 90% of the restaurant employees are out of work now.
Yeah.
I mean, that's thousands, that's 25,000 people that are out of a job right now, just in that one particular industry. So
absolutely,
it's a huge demand out there. So we did have another question of someone, Mahan Tavakoli, our chair, said he agreed with your vision for the future of how we need to take lessons from this and not go back to the old ways. What are some things that you recommend that LGW and its members can do to help make sure we don't go back to all the inequities that we've had in the past? Although I do think after this, the wealth inequities are going to be even worse than they were before we started. So anyway, any thoughts on that?
Yeah, so I think, again, that's why the community of LGW leaders are important for so many reasons, not just because of what you can do from a philanthropic perspective, but from the decisions you get to make in the businesses that you're running and that you're leading. I always make the point about the protections that my parents had, in being what would now be considered sort of low wage work. But those were good and decent jobs that helped to propel our family to the middle class. But just to keep those things in mind as we are rebuilding, as we're shifting, that to really get at income inequality, it means that there's going to have to be some giving up of something and a sharing of more so that people can continue to make a good life for themselves. On the philanthropic side, I would encourage, sustained giving to to nonprofits. It doesn't have to be through the Community Foundation. There are lots of great organizations that are doing fantastic work. We can give directly to organizations that are working at a grassroots and community, who understand the community that they're serving. And I'd like to, we've not been able to prioritize funding for, for the arts or for public radio, but those are also important sectors that are going to have to figure out, how to rebound and how to sustain during this period. Like us, we had to shut down our gala, but there's going to be most nonprofits are able to make up for any shortfalls in their cash flow through galas and public events. And so, and we know this, LGW had to cancel its annual event. It's going to
postpone. We are
postpone. Yes, postpone. Sorry.
We've got a date of October 10th for our annual awards dinner honoring artist Sandra Cowan. If we can't do it in person, we will do it virtually that night. But yeah, it's a huge challenge.
It's a huge challenge. And so, philanthropy is going to have to continue to, again, stay the course, along with our partners, of course, in local government, working very closely to make sure that every element of our community is supported. Now is not the time to retract if you don't have to. It is the time to continue to lean in.
And have you given thought to the difficulty that governments are going to have? They're losing funding right and left. The tax revenues are not anywhere near where they used to be or where they will be for some time. So that's going to cut back their funding for a lot of the nonprofits, a lot of social services and other needs.
Yeah, there's going to be, in the nonprofit sector, we're expecting that there's going to be some contraction. And we saw this in 2008 and again in 2011. Where the conversations around mergers, it's going to have to be a real conversation that we shouldn't wait until we're 6 months down the road to begin to have, but to begin to think about having them sooner rather than later. Again, it's unfortunate, and I was on the town hall this morning, LGW town hall, but I agree with Victor Hoskins. We're going to make it. We're going to figure out how to pivot. We're going to become innovative. I think we're going to have to listen to people who are, fresher with ideas than perhaps us, even Doug, to think about what the future can look like and how we can create, not only address the inequities, but also build a brighter future than the one we currently have.
Oh, I agree. It's an extraordinary time for innovation. Everybody's going to have to innovate in terms of what they do or what they did.
Yeah.
Find new ways to do it if they want to be successful. So we're seeing a lot of really creative ideas sort of just blossom right now. It's very, very, very creative, very innovative time that we're in. A very tragic time as well, but there's a lot of great thinking going on out there.
That's right. And all the conversations we've had about, bridging the digital divide, for example, like we've had to do more to respond to, to some of the challenges, the persistent challenges that we knew existed in our community. We've had to do more in the last 10 weeks than we probably have done as proactively in the last 10 years. We know what the issues are. And we just have to continue to push ourselves to respond to them and to respond to them with some urgency and pace.
And we're at LGW, we're providing more programming for our members than we've ever had before in a very quick turnaround. And it's really, again, it's kind of exciting to be part of it, to see how quickly we can pivot and how nimble we can become. So.
Absolutely.
So Chase has a slide of ways to help the Community Foundation, and ways to get information from them. Anything you want to say about that?
Sure. I only got to name a few names of our partners. They are many. And if you go to the communityfoundation.org COVID-19 and click on partners, you'll see a list of all of our partners. Again, we encourage you to continue to support the organizations that are doing amazing work. And if you can't find them, we are more than welcome to help you to find them.
And I got to ask, what is this Get Shift done for DMV? What?
Oh, that's a partnership that we launched probably 4 weeks ago with the Nationals Philanthropies. It's based on a model out of Texas, where we are trying to partner workers who've been laid off or furloughed with food distribution outlets to serve to run shifts to help them to load, to assemble, and to distribute food.
Oh,
An hourly wage to the workers who sign up to participate in that.
that's great. Well, Tonia, thank you very much. We're going to send we're going to send that slide out to everybody.
Okay.
We've recorded this. We're going to send that recording out probably tomorrow. And you're also going to get a evaluation email from us very soon after we end this day. So please, those of you listening and watching, please send it out. Please fill it out and send it back to us. So Tonia, any last words? We're right at 45 minutes. Any last words?
No, I would just say thank you. I get to spend a good part of my day thanking people both on the nonprofit side and on the side of philanthropy for the amazing work that they're doing to respond. So I just want to end with a huge thank you to our broader community for stepping into the gap.
Tonia, thank you so much for being part of this discussion. I really enjoyed it. It's great to hear all the good you're doing, and it's really uplifting. The town hall this morning, this conversation, it's uplifting to hear all the good things that are happening in the community while we're dealing with COVID. So
Oh, absolutely.
thank you. Thank you, Tonia. Thank you, everyone else.
Thanks, Doug.